And now on to the Healthcare Internet Hall of Fame Awards. And I'd like to introduce two folks who probably need no introduction, Neil Lincoln and Ben Dillon.
Good afternoon. We always like to do these things after everyone's eaten, so we're all sort of subdued by the carb coma that comes at that point. Following on the theme of the John Udis Award, the Healthcare Internet Hall of Fame is another series of ways that we can recognize those individuals and organizations that have really done special things for our space. And remember them in a good way, not in sort of the healthcare.gov sort of way that seems to get an awful lot more press these days. I'm Ben Dillon, and this is Neil Lincoln.
No, appreciate it. And there had to be an obligatory healthcare.gov reference, right? It wouldn't be a presentation without one. So why a Hall of Fame for the kinds of work that we do? I think the key thing that we really need to remember is just how far we have come. I think everybody is talking in these sessions about how far we've got to go. I started coming to these conferences a decade ago. Now, only one hand went up, and we asked how many people were here at the first one. Anybody was here older than a decade ago at these conferences? A few of you. You guys remember being told by doctors more than once that their patients would never, ever use the internet for healthcare services? Or being told that they knew better than you that 3 logins for various aspects of a patient portal would be just fine, and they knew that because they've been seeing patients for 20 years. I laughed too. It was not my finest professional moment. So I think the key here is to remember how far we've come. Yet we got a long way to go, but we want to recognize those that helped us get to where we are today.
So this is an award that, while it was originally initiated by John and the folks at Greystone, is in fact a body in and of itself that exists outside of Greystone in large part. There's a board of judges that consult and vote on various submissions, and we wanted to recognize those folks here today. On our 2012-2013 board of judges is Dan Ansel of Private Health News, Stevie Cannon from Nationwide Children's Hospital, Karen Corrigan of Corrigan Partners, Michael Cutter from Crane Staywell, myself, Ben Dillon, Kathy Divis from Greystone.Net, Danny Fell from Neathawk, Dubuque, and Packet, Andy Gradle from Thomas Jefferson University Hospitals, Paul Griffiths of MedTouch, Sean Gross of Tufts Medical Center, Neil Lincoln of Children's Hospital of Wisconsin, Robin Snow of Affinity Interactive, and Rebecca Dagger-Wardzala of Hendricks Regional Health. If you were on the Board of Judges this year, would you please stand for a moment to be recognized? We'd also like to extend a special thanks to 2 judges who are ending their service with the board this year, Dan Ansel and Paul Griffiths. Thank you for your work with the team.
And so anybody that is interested in what I have found to be a very rewarding and interesting effort, please let us know. If you haven't noticed, there's a table outside for the Healthcare Internet Hall of Fame. We'd love to have more of you involved in the selection of our winners, and so please let us know if you have any interest.
There's information on the table and cards that you can fill out if you are interested in being part of the group. So our candidates for the Hall of Fame are inducted in 3 different categories. We have innovative individuals, innovative provider organizations, and innovative products and services. And we'll go through each one in turn. You'll notice this year that we are not inducting any innovative products and services. None of them received sufficient votes from the groups, but we have a number of individuals and organizations that we're very proud to share the award with this year.
Right. And I want to underscore that last point that the judges went round and round on that. It wasn't that there weren't good products and services on the list, but the criteria for actually getting this honor is high, and good enough is not good enough. That you had to reach a certain level, just like in the Baseball Hall of Fame or the Football Hall of Fame, and I'm sure there'll be some great ones that maybe pass muster next year, but this year they just didn't. So the key criteria, and you can see them on the screen, is numerous lasting and significant contributions to what it is that we do. It fits right into the Hall of Fame. a leadership position, and you'll see from some of the honorees today that they definitely have leadership positions or held leadership positions in the kinds of things we're trying to accomplish. As we just talked, and this is a great segue from the UD's award, a willingness to share their expertise with others in the industry. That's important. A role model or a mentor to others in the industry, and the ability to influence and affect change. And again, I think you'll see that in several of the winners. And certainly they're not new to this field. They've been in the healthcare internet business for at least 5 years.
Now we've got an illustrious group of past inductees. In the individual category, John Udis received the award in his first year. Ed Bennett and Mark Gothberg have both been individual recipients of the award as well. On the Provider Organization Award, Sharp Healthcare, Dartmouth Hitchcock Medical Center, and Community Hospitals of Indiana have all been awarded. And then on the Innovative Products and Services category, the Estrada Content Management System, Epic, Mayo Clinic for their online health content, WebMD, and Patients Like Me have been honored in the past.
So these are this year's honorees, and we'll be going through each of them individually. Lee Acey, Dr. Coop, we'll be talking about him a lot, Dr. Foe as well. The organizations are Cleveland Clinic, Geisinger Health, and the Medical University of South Carolina.
So leading off on the individual category is Lee Acey. Now, most of you know Lee as the director of the Mayo Clinic Center for Social Media. Mayo Clinic, of course, has been a pioneer in blogging and use of social media in general. They have the most popular medical provider channel on YouTube, and then, of course, Twitter and Facebook they're quite active on as well. Now, Lee also provides leadership for the Social Media Health Network, which is a group of individual and institutional members that collaborate to share best practices and overcome barriers to effective social media adoption. Lee has also been deeply involved in the creation and nurturing of Mayo Clinic's own online community for patients and consumers, intended to drive applications of social media into clinical practice, education, and research. Were that not enough, by night, Lee is Chancellor of the Social Media University Global, or SMUG, a free online higher education institution that provides practical, hands-on training in social media for lifelong learners. Lee has been a passionate evangelist for this cause and travels all over the world to talk about the impact that social media can have on our industry. And Lee was unable to join us today, but sent along a video acceptance. And I believe I click this and the magic happens.
Hi, my name is Lee Acey. I'm the director of the Mayo Clinic Center for Social Media. I'm sorry that I can't be with you today, but I'm honored to be inducted as part of the class of 2013 into the Healthcare Internet Hall of Fame. In healthcare, there are an awful lot of diseases, conditions that affect only a very small minority of the population. And most people, frankly, don't care about those diseases and conditions until they're diagnosed with them or until they're concerned that they might have them. And the beauty of social media in healthcare, as opposed to other kinds of social media, is that while you never want to drone on too long, and I'll try not to do that even in this brief presentation, you're not limited by even the 60-second or 90-second viral video phenomenon. I'm fully cognizant of the fact that the views for this video will be in the hundreds maybe. But it's going to people who are interested in this basic topic. Likewise with diseases and conditions that may not affect lots of people, by keeping the production costs low using things like a flip camera or even a smartphone camera, putting video on YouTube where the storage costs are free, where the transmission is free, you can really harness the power of the web in an important and powerful way to meet the needs of patients and consumers. Part of my passion has been to help mid-career professionals, whether communications professionals or healthcare professionals, who may feel a little bit intimidated by some of these tools, to help them understand that they can use them, that it's not that hard. And so I'm delighted also that our Mayo Clinic leadership has supported through the Mayo Clinic Center for Social Media and our Social Media Health Network, providing in-depth training and resources for healthcare professionals to be able to get comfortable, competent, and confident with using these social tools to meet their real business and work objectives. So again, I want to say thanks to the committee for choosing me to be part of the Healthcare Internet Hall of Fame. Looking at those who've been named previously as well as those who are in this class, I feel very honored to be part of it. I wish I could have been there to interact with you in person, but I do look forward to, over the coming weeks, months, and years, hopefully to interacting with you as well. And if there are any resources we can provide to help you in applying social media in your work, in your health-related work, I'd be delighted to do that. So thanks again.
And we encourage you to tweet out congratulations to Lee as well.
Right. So Dr. Everett Koop, this is a bad conference to ask this question of, but if you went to any other conference, I think, and asked how many people there could name more than one Surgeon General in the history of the United States, you'd get no hands raised, right? We all know Dr. Koop, and we know Dr. Koop not just because of the stuff that's on the screen. Go ahead and go to the next slide. But because he was an innovator and really set up what is largely recognized as the first healthcare information site out there. And he was way ahead of his time when he did this. And he had a vision for engaging people in their own healthcare, which, again, was so far ahead of his time. And we look at it today, this is the kind of thing we're all doing. You walk through the exhibit hall, all kinds of vendors are offering the kinds of things that Dr. Koop did many, many years ago. So for his vision and for his wisdom in leading the way in this space, we honor him with the Healthcare Internet Hall of Fame.
Our next Innovative Individual Award is being awarded to Kevin Fo, MD. I can't think of any individual person who's done more to elevate the voice of the physician in social media than Dr. Fo. Now, Dr. Fo is a board-certified internal medicine physician, but I think we know him more as the founder of the very well-read blog, kevinmd.com. Forbes referred to it as a must-read health blog. In addition, Cloud has named him the web's top social media influencer in healthcare and medicine, and CNN has named his Twitter feed at KevinMD one of its 5 recommended Twitter health feeds. In addition, Dr. Fo is the co-author of the book, Establishing, Managing, and Protecting Your Online Reputation, a social media guide for physicians and medical practices. Now, Dr. Fo is a practicing physician in Nashua, New Hampshire, and it's this dual perspective as a practicing physician and a healthcare social media expert that contribute to the unique social media journey that he shares in his keynotes all over the world. He's also transformed his social media presence into a mainstream media voice and has been interviewed in CBS Evening News. He comments regularly in USA Today, where he's a member of their editorial board of contributors. He participates regularly on CNN and the New York Times. And his opinion pieces there particularly highlight the challenges that real-world doctors face, ranging from primary care shortages to the epidemic of physician burnout. Now, Dr. Fo was also unable to join us today, but he also sent a video acceptance.
Hello, Healthcare Internet Conference. This is Kevin Poe at kevinmd.com, and thank you very much for inducting me into the Healthcare Internet Hall of Fame. When I was looking at the other inductees, I was taken aback. What did I do to be mentioned in the same breath as these other, much more accomplished individuals? Last year, when I spoke at the Healthcare Internet Conference, I told the story of how I talked to a family member who suggested that I start a blog. And I started kevinmd.com, but I wasn't sure where this was going to go or how long this was going to last. But over the years, I realized how powerful social media can be when used as a platform where we can hear the voices of the many who intersect with our healthcare system but are rarely heard from. And not just my own voice, but also the voices of other primary care doctors, emergency physicians, surgeons, nurses, medical students, and most importantly, patients, whose voices the medical profession needs to hear more frequently. Social media has given me an education far beyond what I learned in medical school, and it's given me the perspectives of the many who experience the healthcare system through a different lens. I've heard from heartbreaking stories of patients who experience the healthcare system much differently than I do. So I accept this honor on behalf of the thousands of healthcare voices that you don't read about in the newspaper, watch on television, or see in the movies. Kevin MD has given them a stage where we can hear their voices so they can make their own individual difference in our healthcare system. Once again, I'm truly humbled by this, and thank you very much for this tremendous honor.
All right, now to the innovative organization category. Is there anything the Cleveland Clinic doesn't do really well? I mean, this is a space that I think their brand helps a great deal, but their focus on compassionate caregivers who put the patient first is very well echoed in what they do in the world of the internet and on the web. Some of the numbers, I mean, their health hub getting nearly 1 million unique visits a month. Those are numbers that several of us combined together could only dream of, I think. The number one LinkedIn page out there, and some of the things they've done which are truly innovative in this space fits, I think, with their overall quality of care. It's very well reflected in the stuff they do on the internet. Here to accept the award is Scott Mowry, their manager of search engine marketing and analytics. Scott? Congratulations.
On behalf of Cleveland Clinic, I'd like to thank the Board of Judges for the Healthcare Internet Hall of Fame, as well as Greystone for this honor. When I was asked by my boss to come down here to accept the award for our team, I at first thought he wanted me to come down here to write a Health Hub post on the benefits of hurricanes and beignets and jambalaya as healthy recipes, but I was mistaken. But this has been a great honor for us. I've been at the clinic now for almost 7 years, and I was part of our group that originally started to dip our toe in the water for social media. And we went through the same challenges that all of you have at your organizations as well. It's just there's so much uncertainty. There's so much, so many questions you start asking, and what rules do we have to follow? And one of the reasons I think why we've been able to succeed in this is that we really have tried to continue to evolve with what we're doing and really try to challenge and break the rules and find the best practices that worked particularly for us. Social media is still so young that there's not a standard best practice that will work for everybody. So, I always encourage people when they ask us what we do well is to say, find what works for you. You'll find when you talk to patients, you talk to your staff, you talk to anybody in your organization, they have great ideas, and you can use those to benefit yourselves. Even with our pages like with Facebook and Twitter and everything, that there's a lot of organizations I've talked to here, I've heard some very nice compliments about the Health Hub, and they will kind of go back to, it's a large organization, you can do all these things, and we do have some benefits with that. But when we started, our Facebook team right now, we have one person who writes our posts, does the images of the cute dogs or the recipes or the goofy images. And, she works really hard at trying to find out what works. And we've really kind of succeeded with our team of just really encouraging our entire enterprise to look at themselves as being part of our social media team. Ranging from the person who writes the health information article to learn a little bit about how SEO works because it'll be amplified through social media, to really working with everyone just to say any idea you have is good. We can roll with these ideas and try different things and just see if they work. And so I encourage all of you to try the same in your efforts. And the last thing I wanted to leave you with is that what we really like about the Health Hub and Facebook and everything is that social media in healthcare seems to start to evolve now, where it's really starting to go back more towards the patient. There's so many organizations that stress the patient's first approach to healthcare, and with social media, that's really the way to focus on it. It's not necessarily me, here's why we're great, here's our US News ranking. It's more about what kind of information can we give you to the patient to make informed decisions that'll help you in your healthcare or help your family or friends, loved ones, etc. And that's been a thing, that's kind of our North Star that we use to guide us with the Health Hub. And it's going to be, as long as we stay on that path, good things will continue to happen. So I encourage you all to take the same approach. Thank you very much.
Thank you very much.
Our next awardee for innovative organization is Geisinger Health System. Now, Geisinger is well known as a large integrated system that's doing a lot of really innovative things in terms of the way that they deliver care. But our recognition here today is much more about the way that they've utilized technology as part of that solution. One of Geisinger's innovations early in the development of electronic medical records was the implementation of a patient portal. So as they rolled out electronic medical records across their system, they recognized the patient's need for information is just as important as the clinician's. Now, My Geisinger has 40% of active patients using the portal, with 75,000 unique logins a month. And it's become a focal point for collecting patient-reported data as well, and involving that within the clinical decision-making process. Now, in addition to that, Geisinger's commitment to innovation they've recently launched the Institute for Advanced Application to support the implementation of emerging technologies, data analytics strategies, and system engineering solutions to improve healthcare. They also leverage engagement technologies such as a system-wide text messaging program for appointment reminders and clinical needs, a robust social media platform to drive collaboration across their 19,000 plus employee base, and a strong social media presence to bring Geisinger news, health, and wellness information to the communities that it serves. Accepting on behalf of Geisinger is Joan Topper, the VP of IT Innovation.
Good afternoon. It's a great pleasure for me to be here to accept this award on behalf of Geisinger Health System. I've been at Geisinger for 26 years, and what an exciting ride it's been. They embrace innovation and change, and when we started planning for the portal in year 2000, you didn't really have others to mimic. You didn't have the best practices, as was referenced earlier. You need to look elsewhere, look outside of the industry. We particularly looked at banking at that point for secure transactions and such, and you'll continue to push the envelope. Another interesting thing is an organization needs to take time to be innovative. We're all so busy. We're also interested with emails and doing our jobs that you really do need to take time to be different and allow for some failures. Not every innovation is successful, and you do need to allow for that type of incubation and test site and prototyping. A prototype is very different from a pilot. A prototype is just that. It's a test. Let's put the big toe in the water and see if it's going to work. And if it doesn't, you move it aside and you move on to the next test. And with that, healthcare has so much opportunity in front of us. Social media is just, the next big opportunity presented to us. So thank you so much. I appreciate this award and accepting it.
Thanks so much.
Appreciate it.
You bet. All right, Medical University of South Carolina. How many of you have had the discussion of, do we have the development team on our web group, or does it stay in the IS or IT organization? Right? That happened a few times. In 2004, the Medical University of South Carolina had their own web developer on their web team. That was mind-blowing at the time, and just based on the number of hands that went up, it's still unique today. This is an organization that has been innovating on the web, I think, from the very beginning. Back in, as you can see from the slide, in 1998, they went from a real IT-focused site, which I think many of us had at that particular point in time, and really came out with a website that was focused on patients and consumers, and that was, again, ahead of its time. The number of awards that they've earned won't even fit on the slide, and they won another one at the Best in Class Awards just the other night. So to accept the award is Mark Samber, who is the his title is the Chief Web and Digital Strategist. Mark, there you are. Congratulations, Mark.
Thank you. All right. Well, thank you very much. Thank you to the Board of Judges and to Greystone and basically to the whole conference for just a tremendous educational and learning opportunity. What's interesting about me accepting the award here on behalf of MUSC is that I joined MUSC 3 months ago, so the bar has been set pretty high in terms of innovating. My boss, our chief marketing officer, is Christine Murray. And for those of you who know Chris, she's been in the industry for over 20 years, has been involved with the web and marketing at MUSC, and she's really been an innovator and a pioneer and a very forward-thinking individual, and that has I think led to some of the accolades that we have here. So I have some notes just because I am new to MUSC, so I need to kind of keep my mind fresh on this. But I just want to let you know, MUSC was founded in 1824. We're the South's first medical school. We've got about 13,000 employees. We have six colleges within the medical school. We're an academic medical center with a highly diverse clinical focus. And we're a level 1 trauma center, and we have tried to be an innovator with the web, and I think have looked at several things over the years to try and accomplish that. One of which is Chris's motto has just been to just think big, but take small steps and do it. And it's proven successful. So as was just mentioned, I'm sure we've all had conversations with IT as to who owns what, and we continue to have those conversations. But Chris's approach has been to just say we're going to go out and we're going to blaze a new trail. We're going to lead the crowd. And that's been a good strategy for us. We've got a very large presence, probably about 40,000 pages on our website, which in some cases might be too many pages. So we're looking at that. But one of the things that Chris has tried to instill in the team is to seize every day and try and look at an opportunity that you can take to serve your service lines, your departments, other individuals in the organization to try and deliver a better patient experience ultimately. And that's a tradition that, me being new in the position, I'm very much looking forward to extending. And don't hesitate to align your team with the right visionaries, the right people. She, as was mentioned, she was one of the first I think organizations to embrace web development. We've been with our CMS vendor since 1998. We sometimes get out on the leading edge with new technologies, and sometimes you get caught. You get a little bloody on that bleeding edge. It's not just a leading edge, but you got to take the lumps with the risks, and you just plod forward. So I'm pleased to be here on behalf of MUSC to accept this award. And thank you very much.
Don't leave without this.
So one final round of applause for our entire class of 2013 inductees.